the next generation of cardiologists to dream even bigger and serve even better. To all who contributed to this 50-year journey, our gratitude is eternal. And to those who will shape the next 50, you may carry this proud legacy forward with same courage and conviction. And leaders are those who transforms their dreams into reality. So we have to really remember, acknowledge the contributions of GKNM family for contributing such a wonderful world-class cardiac hospital to city of Coimbatore. Lifetime felicitation. In fact, morning we were really worried. 140 crore Indians. Heartbeat was fast. Even our tension was too high. So, with the blessings of God and with the blessings of nearly 140 crore population and Indians, today around 5 o'clock, ceasefire has been agreed upon. So that's a great relaxation for every 140 crore Indians. Kept apart, in fact, I am very happy and privileged and honored to be part of this Golden Jubilee celebration of cardiology at GKNM Hospital. In fact, this is what people with vision can contribute. This is what happens. People, we call them as a visionary leaders. Leaders are one who really inspires and motivates. And leaders are those who transforms their dreams into reality. So we have to really remember, acknowledge the contributions of GKNM family for contributing such a wonderful world-class cardiac hospital to city of Coimbatore. Coimbatore is always known for many firsts. In fact, it was known as city for automobiles, city of textiles, and city for healthcare, city for education. And in fact, in the entire state of Tamil Nadu, after Chennai, the next most busy commercial as well as the most progressive city is Coimbatore. So in fact, I know about this JKNM hospital through Dr. S. Natarajan, because both of us were studying DM cardiology at KMC Manipal. I completed DM cardiology in 1988 and he completed in 1989, and today we are here. So that's a great feeling that we are here. So, GKNM cardiology unit today, of course, has got all the facilities that are available elsewhere in part of the world. And there is an explosion of technology on one side and aggressive marketing forces on the other side. So, in between we stand patients as well as doctors. So, need of the hour is to provide a quality care at an affordable cost to the cross section of the society. So, that's what the JKNM hospital is providing. And yes, we use the word honor, we use the word pride. Pride comes when you think you have done something to this society. When you yourself think, I have done something extraordinary to this society. Honor comes when society thinks that you have done something back to the society. So today, the JKNM cardiology wing in fact, I have to congratulate all those who have contributed for the growth of cardiology in JKNM hospital, cardiologists, cardiac surgeons, staff nurses, technologists, and everybody. Because it was a mirage to have a cardiac surgery in 1980s. Only those who have money here and there, they were getting surgery. To establish a cardiac cath lab in 1988, it is really challenging. So I really congratulate the JKNM administration for bringing a state-of-art cardiac facility to Coimbatore. So, in fact, today in India we have nearly 3,500 cardiac cath labs. 3,500 cardiac cath labs. And going by the magnitude of the disease, and also looking at the size of the population, India needs somewhere around 7,000 cardiac cath labs. 7,000 cardiac cath labs. So another thing, today in this era of digitalization, in this era of various technological advances, you take any specialty, not just cardiology, you take any specialty, contraindications have become indications. The things which were not possible to do today is possible. For example, when we were cardiology students, coronary angiogram was contraindicated for acute myocardial infarction. Today it is the indication. For example, yes, nobody thought a cardiologist without surgery could deploy a valve in aortic position or in mitral position in pulmonary position. So despite all these things, see, always nature is ahead of technology. Nature is always ahead of technology. So the need of the hour, still, despite all this, today we are talking about artificial intelligence, today we are talking about machine learning, and I think there is a lot of we are talking about minimally invasive procedures. Still in this background, we belong to those generations where I think 3 T's are very important, despite all this explosion of technology and various gadgets available. 3 T's are very important in every discipline of medicine or surgery. That is talk, touch and treat. So this is where we are missing all those things. So we are, I think, talk, touch and treat, and if you follow that systematically, the 4th T gets added, what is called trust. So many a time, we look at only images, we look at only investigations, and the most neglected person in that whole scenario is the patient. So I think still we need to have a good mix of both clinical evaluation as well as the various procedures. And decision making is more important in particularly in any profession, particularly whether it is medicine or surgery. So we should practice these 3 things very important in our profession. That is, decision making is more important than incisions, decision making is more important than interventions, and finally, treatment should not be more harmful than the disease. So these 3 things are extremely important while treating patients. In fact, since it is a cardiology, the 50 glorious years of cardiology, today in India, 60% of deaths in India is due to lifestyle diseases, 60%. So the important components, important players of these lifestyle diseases, one is heart attack and cardiovascular disease, diabetes is second, high blood pressure, then stroke, then cancer. And the 6th one is added to the list of lifestyle disease is what is called screen addiction and life loneliness. Loneliness is not that they are alone, they are together, but still they are physically they are together, but mentally they are apart. So 60% of deaths. Unfortunately in India, all these diseases are premature, which occurs 10 to 20 years earlier compared to the Western population. Earlier, children used to bring parents for the treatment of heart attack and heart diseases. Today, what is happening? Parents are bringing their children in the age group of 20 to 40 years. In fact, we have done our own study at our Deva Institute between 2000, I'm talking about pre-COVID, 2014 to 2018. Nearly 6,000 young heart attack patients were treated. 30% of heart attack in India is below 40 years of age. So this is the magnitude, and this is where possibly we have to adopt. Morning we were discussing, we have to, because 30% of deaths in India is due to heart attack and brain stroke. So we need to deliver treatment in the golden hour for all these things, whether it is heart attack or whether it is brain stroke or maybe even the road traffic accidents. So all these things need to be addressed within this golden hour. So of course we have various schemes, and Tamil Nadu is always on the forefront of healthcare advances and healthcare services. In fact, infant mortality, look at, those are some of the great parameters of your public healthcare services. Infant mortality is certainly low here. India is a country in diversity. All these things differ from north to south, east to west, and these things are happening. So definitely we need to adopt, because it's not possible to do an angiogram, angioplasty for every patient of acute myocardial infarction, because in semi-urban and rural India, we have to thrombolize them. We have clot dissolving medicine. We have to give this clot dissolving medicine in the golden hour on the hub and spoke model. Then after stabilizing, they can be shifted to a near city where angioplasty and stent can be given without wasting time. So in fact, I spoke in the parliament on this particular issue. In fact, in Tamil Nadu, in some states, in Tamil Nadu, Karnataka, Goa, Telangana, as well as in Orissa, this urban spoke model is started, but still probably because 30 lakhs people die because of heart attack in India. It's a very big number. It's number one killer. So, and if you look at the death rate, in Tier 3 cities, death rate due to acute myocardial infarction is around 22%. Coming to Tier 2 cities, it is 15%. Coming to Tier 1 cities, is 6%. So we need to really you have to bridge the gap, because it's not possible to do an angioplasty in a village or a rural area. So this urban spoke model has to be initiated across the country to save his life. In fact, in the Parliamentary Standing Committee, it has been recommended to the Union government that urban spoke model. Only thing is, this thrombolytic agent has to be tenecteplase rather than streptokinase, because of course I have to explain in a collective language, just 1 minute injection, just 30 milligram, one shot. So another important thing, what we are looking at, actually we need to strengthen. Today you look at India's number of medical colleges. We have close to 720 medical colleges. Probably nowhere in the world, any country has so many medical colleges, 720 medical colleges, 1,20,000 MBBS seats, 75 to 80,000 MD, MS, that is broad specialty seats. So at this point of time, India has got almost 16 lakh allopathic doctors and 5 lakh Ayush doctors. Going by this, we are saturating by 2030. We are saturating by 2030. After 2030, certainly there will be a massive unemployment for the doctors. So only we are talking about numbers. What is really important is the quality of training, the quality of products is very, very important. And unfortunately, what is happening because of explosion of technology and gadgets and also this machine learning, artificial intelligence, the clinical training hands-on training is getting affected. Clinical teaching has really taken a backseat. This is where, in fact, all these erstwhile cardiologists who are sitting here, Dr. N. Subramanian and Dr. Periyaswamy, Dr. Manoharan, Dr. Natarajan, I think they have all contributed to this course. Still that basics training is very, very important, because actually what is happening because there are many medical colleges, private medical colleges, where there are more medical students than the patients. As a result, they are underexposed and hands-on training is not happening, because off-bed doctors are more dangerous than the disease. So I think this is where we have to look at this, the quality of training, and that is very, very important. So in fact, GKNM stands out as a center of excellence. My hearty congratulations to the entire team of cardiology. So the word care is very, very important. See, always care means C stands for compassion, A for attention, R for respect, E for empathy. So of course, today we are talking about holistic approach. We have naturopathy, we have allopathy, and we have even Ayush, whether it is naturopathy or whether it is allopathy. Most important, we should have sympathy for the patients. That is very, very important.
Dr. Sambasivam, our Chief of Department of Cardiology, Dr. Vipin Wilson, Consultant Cardiologist, honored guests, all delegates and members of GKNM Hospital. It is with immense pleasure I stand before you as we celebrate Golden Jubilee of our Department of Cardiology. This department is a symbol of pioneering spirit, resilience, and commitment to saving lives. 50 years ago, the idea of a specialized cardiac unit in this region was an ambitious dream. It took shape with visionaries who believed that even in a non-metro city, patients deserve world-class cardiac care. From a modest 3-bed intensive care unit to today's state-of-the-art facility, offering cutting-edge interventions including cardiac catheterizations, structural heart disease procedures, and a dedicated cardiac ambulance, we have come a long way. This department has truly been a torchbearer, being the first in many fronts across the region. More than just being a cardiac clinical excellence, this department has been a cradle of academic advancement. The DNB program has trained generations of future leaders. Our strong portfolio of research and innovation continues to influence cardiovascular science both nationally and globally. At this time, I would like to take a moment to congratulate the commitment and dedication of the entire cardiac team. Cardiologists, surgeons, anesthetists, nurses, technicians and the staff who have consistently delivered outcomes that match the best in the world. As we look ahead, let this celebration not only honor our past, but also renew our commitment to push boundaries, embrace emerging technologies, and stay anchored in patient-centered value. Let us inspire the next generation of cardiologists to dream even bigger and serve even better. To all who contributed to this 50-year journey, our gratitude is eternal. And to those who will shape the next 50, you may carry this proud legacy forward with same courage and conviction. Thank you all. God bless.